45,000 Americans die every year. That's 122 deaths a day due to lack of health insurance. That's the startling finding of a new study that appears in the current issue of the American Journal of Public Health. The figure is about 2.5 times higher than an estimate from the Institute of Medicine in 2002. The Harvard-based researchers found that uninsured working-age Americans have a 40% higher risk of death than their privately insured counterparts, up from a 25% excess death rate found in 1993. Deaths associated with lack of health insurance now exceed those caused by many common killers, such as kidney disease. News of the study comes as the drive for health care reform is entering a new phase on Capitol Hill. On Wednesday, Montana Senator Max Baucus, the chair of the Senate Finance Committee, released his long-awaited health care reform proposal. The Finance Committee is the last of 5 congressional panels to produce legislation.
Despite months of talks to find a bipartisan compromise, Baucus's plan had no Republican co-sponsors. The $856 billion proposal would require almost all Americans to buy insurance or pay a penalty, and drops a mandate that all employers offer health coverage. The bill does not include a government-backed public option to compete with private insurers. Instead, proposes funds to set up nonprofit cooperatives. For more on the proposal, we're joined by Dr. Steffi Wohlhandler, professor of medicine at Harvard University, primary care physician in Cambridge, also co-director of the Harvard Medical School General Internal Medicine Fellowship Program. She's co-founder of Physicians for National Health Program and co-authored the American Journal of Public Health study called Health Insurance and Mortality in U.S. Adults, joining us from Watertown, Massachusetts. Professor Wohlhandler, Dr. Wohlhandler, thanks so much for being with us. Assess Baucus's plan.
Baucus's plan is a complete sellout to the insurance industry. The counsel on the Finance Committee that oversaw the development of the bill is a former vice president of WellPoint, a major insurer, and the insurance company's interests are protected in the bill, but the interests of the American people really aren't. At best, this bill is going to leave 25 million Americans with no health insurance, and our study indicates that about 25,000 will die annually as a result. Really, what Baucus is doing is protecting the profits of the private health insurance industry and sacrificing American lives.
What about the affordability issue that's been raised by some critics, or began to be raised as soon as the announcement came out?
Well, the way to afford universal health care is to go to Medicare for All, also known as single payer, also known as nonprofit national health insurance. That's the way every other developed nation achieved universal health care. They spend less than we do. In fact, the average for other developed nations is about half the per capita cost of health care that we have. People in Canada and Western Europe live longer. They don't have to worry about having medical bankruptcies because their health insurance didn't pay for things. So the nonprofit Medicare for All approach is the only affordable way to cover all Americans. Of course, the insurance industry hates it, and when you put an insurance industry vice president in charge of writing a bill, you shouldn't be surprised to see that the insurance industry profits are protected, but American lives are sacrificed.
Explain what you mean by insurance industry vice president.
Well, there's a woman named Liz Fowler, who is the senior counsel for the Judiciary Committee, and her charge was to lead the effort to design this bill. But it's not just her, it's the millions of dollars in donations that Baucus and other politicians have accepted, the millions of dollars in donations from the insurance industry to President Obama. It's President Obama's decision from the get-go to play ball with the insurance industry, to compromise with the insurance industry, to involve them in the process. And of course, you give them an inch, they take a mile, and what's left of this bill is a dream for the insurance industry. The individual mandate creates millions of mandatory new customers. Uninsured people are being told, you're the problem, we're going to fine you up to $3,800. We're going to give you a fine, a penalty, because you're uninsured and you don't have health insurance. The individual mandate is a complete misunderstanding where the responsibility for this is. This problem is not caused by the uninsured themselves. It's caused by the health insurance industry, and our Congress and Senate needs to confront the health insurance industry, say we're going with Medicare for all. There's absolutely no reason to have a private health insurance industry. They add no value, they add a lot of costs, and those costs are so high that it means we cannot get to universal coverage with the insurance industry in the middle of things.
Now, you have an individual mandate there in Massachusetts under the Massachusetts plan. How has that worked?
Well, it hasn't worked very well. When the individual mandate was rolled out this past year, we saw no improvement in the number of uninsured in the state. We actually saw a deterioration in access to care. The previous year, they had rolled out a Medicaid expansion. That worked. That got some people covered. But when they rolled out the mandate this year, there was no improvement in the number of uninsured. The Census Bureau just announced that only half of the uninsured were covered by that Medicaid expansion. It also found that there were 5.5% of people in the state uninsured. That's not universal coverage. And then our private insurance industry just announced that they're raising all of our premiums 10%, and they're saying that's because of the cost of the reform. So in Massachusetts, we've spent a lot of money. We've managed to cover about half of the uninsured through Medicaid expansion of Medicaid-like programs. We've given the insurance industry absolutely everything they wanted, and what we're getting is higher prices and still having uninsured people in the state.
Dr. Woolhandler, this report you just came out with, 45,000 people a year die from lack of health insurance. Where are these numbers coming from?
Well, this was a federal study done by the CDC. They collected the data. Of course, we analyzed it. They collected the data. They interviewed thousands of people and also had them examined by a physician and gave them lab tests. So we have very detailed information, not only about socioeconomic factors like education and income, but also their baseline health. How healthy were they at the beginning? Some were uninsured, and then the CDC followed these people for up to 12